Hi, everybody. Welcome to our webinar. We are talking about unlocking the future of regenerative aesthetics, trends in regenerative medicine, making sure everybody is staying compliant, talking about some patient safety pieces. We are so excited to have you here. I know time is precious for everyone, and you are likely on your lunch, maybe having a bite to eat, listening to us. So I'm going to go ahead and jump right in. Let's talk about what we're going to, I skipped that slide. There we go. Let's talk about our agenda for our webinar today. We are going to meet our hosts, myself and Mr. Troy Bretz that you see right there. We'll introduce ourselves and our company a bit. We'll talk about the evolving aesthetics industry that we all know and love. Then we'll jump right into talking about some top regenerative medicine trends, cover some safe practices, have a little Q&A session, and we will get you back to your work day. All right, let's introduce ourselves. So my name is Sarah Wedel. I am a nurse practitioner, and I am the Director of Clinical Operations here at Spa Connect. Spa Connect is the industry leader, the most trusted company for your good faith evaluations or your health screening exams before your patients are going through their elective aesthetic treatments. And I am joined today by Mr. Troy Bretz from Dr. PRP USA. And Troy, I'll let you introduce yourself a bit.
Thank you, Sarah. Yeah, I just want to thank you and Spa Connect for inviting me and Dr. PRP to join you on this great conversation. Troy Bretz, I'm the Service Operations Manager. I joined Dr. PRP USA just over a year ago. The company's been formed since 2014, focusing on supporting aesthetic clinics, orthopedics, and a wide range of other applications for platelet-rich plasma. And we have, obviously our Dr. PRP kits and other accessories that generally we'll maybe talk a little bit about today.
Perfect. Yes. Troy and I have done several clinical in-services together for our team and just continuing education, and met up at conferences. And Spa Connect and Dr. PRP are two really synergistic companies that work well together. Spa Connect was established in 2012. Dr. PRP has been doing their thing since 2014. We've kind of united and are trusted partners working both ways with each other. So if you are a Dr. PRP client and you are not a Spa Connect client, I hope that changes today. And same thing, if you are one of our Spa Connect clients and you are not a Dr. PRP client, I hope that changes today as well. So we'll talk a little bit about that, but we work very well together, and I'm very honored to have you here with us and have them. Dr. PRP is a trusted partner for us here at Spa Connect. So thanks for joining us. All right, well, let's just jump right in a little bit. So as you all know, our world in general is changing, but in the aesthetic medicine industry, it is wild, right? So ensuring patient safety in aesthetic medicine requires a heightened level of vigilance. And why that is important to point out is because the industry is constantly advancing with innovation, treatments, medications. Some of these lasers can probably knit you a sweater now, on top of being ablative, not ablative. Maybe they can take you out to lunch. They can do all sorts of things with these new state-of-the-art devices and emerging medical technologies. So really being aware and abreast of changes that are happening are absolutely crucial for your medical spa, for your patients, and for you as a clinician. We see this servicing med spas and dermatology practices and surgical plastic surgery offices all over the United States, just how much changes just very, very quickly, with whether it's protocols, evidence-based guidelines. Things change fast, and you want to make sure you're staying up to date with that. Are you seeing that on your side as well, Troy?
Absolutely. Yeah, I mean, we get a lot of questions from patients that may be looking at particular treatments, particularly obviously PRP, and they'll be hearing things in the news or their own research and see things evolving, and they'll be looking for clinics that have that type of treatment. And so one of the great things about partnering with Dr. PRP USA is we'll help that patient find a clinic in their area within the Dr. PRP client network. So, and we have obviously, clinics and physicians looking for the latest on PRP and biofillers and, microneedling and the like, so that they can stay up to date with what they're offering for patients.
Exactly. And that was a really good point about something on the news. the aesthetic medicine industry really is growing and branching into wellness, and it is getting a lot of coverage, right? So you're seeing stuff on, my grandma will say, "Hey, I saw this on the Today Show." It's like, yes, that's right, the Today Show, or it's on local news of talking about wellness and longevity and things that you can do for your health, and that's playing out in real life. So we're getting those patients trickling in. So our patient population is being more and more diverse as well. So the more information that's out there, the better. So that kind of really inspired Troy and I to do a short little bite size, a mini candy bar bite size of this topic for everybody today. So without further ado, let's get into regenerative medicine and what is it and what are really popular cutting edge stuff that you guys are seeing on your end. I'm really excited to hear you talk about this, Troy.
Yeah. Well, thank you, Sarah. Yeah, we could talk probably for the next several hours on different trends and return to regenerative medicine and ways of using platelet-rich plasma, right? Which is just basically capturing the platelets, which is those proteins that harness the growth factors for the individual that had their blood drawn, right? Processing the blood, making the PRP, and then redistributing that on the patient. And so allowing their natural body's functions to heal itself wherever it's applied, whether it be the skin or a joint or wherever on the body, essentially. So one of the most, I would say, sought after and questioned uses of PRP that we've had over the last probably 12 months, and we continue to experience here in 2025, is use of PRP for dry eye disease, right? So a therapy that can be used for administering as eye drops. And this is probably, if you're doing PRP today, this is a very easy way to apply that. Obviously, you're making your PRP and providing that right there in your clinic to your patient. So they're walking out with their eye drops. We have not only clinics looking for it, but obviously patients. Again, this is one of those where we have patients calling and saying, "Hey, I need PRP eye drops. How can I get them?" And so we'll try to connect them with someone in our, like I said, a user of a Dr. PRP system, and provide them with that service.
It's amazing that when you mentioned PRP eye drops to me, it was probably a year ago now, I was like, what? I just, as a clinician, was so excited to hear about this. And we were talking about how this is such a great gateway too, because we have all sorts of practices getting into aesthetics that are just kind of dipping their toe in the water of, like, maybe they're doing Botox or something like that. And then you can bridge that patient into being one of your actual patients in your HENT clinic, in your primary practice clinic, in your derm practice. It's a really good way, especially this treatment in general, because who doesn't have dry eyes from all of the screens that we stare at every day, from, the computer, TV, phone, laptop, everything. So these are just, it's a really, really cool treatment. That's, Troy was saying, has some really impressive results.
Yeah, absolutely. There's definitely numerous studies over the last decade that show positive results of using PRP for this type of application, even for post LASIK use.
Oh, wow,
right? So if you're having LASIK surgery, this can be a therapy to administer to the eye in healing over the several weeks after that. So there's actually a study specific towards that. Like I said, this is an easy one that people can implement. Obviously, contact us and we can work with you to make sure that that's an easy win for your clinic and your patients.
I know I would have probably sold a kidney to get some PRP eye drops after I had my eyes done. It was just the dryness, just thinking of that now. If you would have been there like, "Hey, do you want to fix that?" Like in an alley, I would have been like, "What do you want?" Like anything, I'll give you anything.
Right. Yeah. I don't think the cost is as expensive as giving a kidney.
What's the market value on that these days?
Yeah.
I don't know.
So it's definitely more. It's definitely beneficial to seek that out and keep both kidneys
Yes.
when you're going about it. Another one that we've gotten, we really seen quite of an uptick just this year is the sexual health and fertility piece. Those are kind of two different things. It's sexual health being more of the male or female specific shot that may be related to sexual dysfunction, right? Maybe ED for a male, or slow arousal or dryness for a woman. And there's, again, mentioned studies on the previous topic, but there's studies again where the PRP is being used as an effective method for these type of situations.
Right. And something that they can have done in office, walk out, no problems. But it's not a huge process to go through either, and see results quickly.
Yeah, exactly. I mean, it's a very short procedure, and you walk out, obviously that day, and you're back to kind of your normal life, within an hour of the appointment. So, and we, in terms of somebody that's certified in the male female type of shots, we've actually partnered with somebody, Sylvia Silvestri, on that. So if anyone's looking for she can obviously help in that arena for that type of certified training. And then, the fertility piece is kind of a different animal, right? That's where, unfortunately, and you hear it probably in the news quite often, where people are struggling to conceive, a child. And so PRP is one of those regenerative therapies being looked at and evaluated again through research as an effective means, and it's, again, both for male and female uses. For the female piece, it gets a little bit more complex, because you're going to want to have an intervaginal ultrasound guided PRP therapy, and that obviously adds a little bit of cost to a clinic, so it's kind of specialized in that sense. Whereas the male would be a little bit less complex for application. Right. But again, both patients and clinics have been inquiring on that particular one, just because there's been the recognition that hey, we have a challenge in our society today of fertility challenges, and PRP, based off of research, has been shown as a therapy that can be applied in this arena. So
right, exactly. Oh, Mal Nicole, PRP eye drops sounds so amazing. Must try. How cool. I know. I agree. I'm still figuring out. I got to get my hands on it. Actually, with that comment, Troy, can you talk a little bit about what the patient, it's not just like drops in office. The patient goes home with those, correct?
That's right. Yeah. The clinic would draw blood, process it, make the PRP, and then just provide that to the patient to dispense on their eye, based off a particular protocol that physician or medical professional would develop for that particular need. Right. Everyone may have a slightly different need depending on their condition. But yeah, they take it home, and then they need to keep that either in the fridge or the freezer for sterilization, and then they go about using it from there on. And we've heard a lot of positive results of how PRP, again, from patients even, of the benefits that they receive from their PRP eye drops.
Right. And it's just, and this kind of ties what we talked to about sexual wellness and fertility too. It's that patients making that investment are seeing the results, right? So making that investment with the PRP eye drops, it's not just a one and done. You get to take it home and continue that treatment to truly help your body kind of heal itself. And then the same thing with the sexual wellness and fertility too, is you're making an investment in your own self to see those results. And looking at fertility too, when you're looking at cost factor, using something and trying something like PRP is a much more cost-effective way, because things, I mean, my gosh, when you're paying $9 for a carton of eggs at the grocery store, this inflation is wild. So, PRP is an economic way to really get the ball rolling and start that process.
Yeah, economic and natural, right? Again, you're basically capturing the body's natural healing and regenerative processes and functions, and focusing that in the area that needs that attention. In that particular case, we just talked about the fertility piece.
Right.
So yeah, definitely, it's great to see that again, it's getting the publicity and the attention that's warranted.
Right.
So the first two kind of are maybe things that people haven't really thought about or considered, or are growing at maybe faster rates than others. But hair restoration is another one, right? That's one that's probably been around for several years. But as we continue to age, and the stresses of inflation, and life in general, right? We see that we have receding hairline, or clumps of hair, going out in different areas. And so PRP again is one of those really excellent uses, to kind of stimulate the cell proliferation around the hair follicles, right? So that the hairs can continue to grow if you're experiencing that. Again, male or female can benefit from that.
Exactly. So I have hands-on experience with this with patients that I've practiced with and taken care of, and the results that I saw with PRP hair restoration, especially after COVID, there was a lot of patients that had, they just didn't know what else to do. It was like they lost a significant amount of hot hair post-COVID, and it was just kind of like, well, this is how we live now. I was like, no, you don't have to. You don't have to at all. So doing the results and having the patient come back, because at the clinic that I work at, it's a protocol, right? We normally recommend at least 3 to 4 times of coming back. The results just on, the before photos and after photos, and each appointment we would compare them. And it is absolutely astounding just to see that growth. One of my patients, like, my hairdresser's asking what I'm doing. I'm like, yes, exactly. So it's just, and it's your own self. It's natural. Like you're saying, it's your own self stimulating yourself to kind of be like, hey, wake up, little hair follicle. And it's the results are really impressive.
Yeah. Wake up and get moving.
Yeah, exactly. We're not done here. We're not done.
That's right. I mean, if it grows depending on where you are in your life cycle and your life stage, maybe it's growing a lighter color than it did before, but at least it's coming back.
Beggars can't be choosers, right?
Yeah.
You take it how it comes.
That's right. And so again, hair restoration is a big one. We've seen a lot of clinics adding that, and as well as other therapies for PRP. Right? If you're already doing PRP, hair restoration is a really simple one to implement into their offerings for patients.
Exactly.
And kind of like the hair restoration, microneedling is one of those things that's been around for a number of years. But microneedling itself is very beneficial, right? In the collagen induction aspects. And then when you combine that with PRP, with capturing the platelets and applying that during and post microneedling therapies, you see patients have less downtime and quicker results as a result of combining the two.
Right. Oh, I see a comment there. Wow, that's really interesting. I hadn't looked into these before, and now I'm definitely going to go. Yes, don't walk, run and go look at these. They are incredible. And we just talked about microneedling, and one of the huge benefits with that too is, right, you're putting on this just liquid gold essentially on your face, or if you're going to microneedle it on the scalp, you're putting it on there, and then you're going to have that stimulation. It's just your own body saying, hey, self, we need to do something here. And things are stimulated, and you are going to see those results quicker and usually a little bit longer lasting too. Correct, Troy?
Right. Yeah, it's really good for just overall skin rejuvenation in general. Kind of like you were saying, and it can help with obviously just the general fine lines, but also scarring or acne scars. And so the application of PRP there kind of gives you that more enhanced and robust result that can come with microneedling.
Right. Let's see. Megan says, at what age would you recommend someone switch to another modality such as exosomes or peptides? Do you have any thought about that, Troy?
At what age? Well, I mean, I think again, PRP can provide probably a significant alternative to the exosomes and peptides. As well as there's some protocols out there that may combine PRP and exosomes. So I think the question would be is to, in terms of what age, obviously 20s would be, a reasonable age to start looking into harnessing that. It's kind of when you start losing some of that freshness of the skin, right? And so if you can capture that and maintain that in your 20s throughout the several years after that, you can maintain that rejuvenated look that you have on your skin.
Right. I for sure agree too. And it's hard, Megan, with, every patient is so different too, of like what their goals are, what their medical history is. But as Troy said, there's a lot of protocols that mix and match. And a patient may have better results with one thing versus another. PRP, I personally really like it, and I live in the Midwest, and in the Midwest it tends to be a little bit more like conservative, like, ooh, I better not, don't want to look too crazy, don't want people to notice. And PRP is just a really nice thing to just be like, you know what, it's yourself healing yourself, and trying to kind of like restart the engine of the area that you're applying it to. There's a lot of research behind it as well, too. But I don't think there's necessarily a specific age. You can mix and match and look at the person's skin and their medical history too. So like if you've had somebody who's been a lifeguard for the past 15, 20 years, that skin is going to look very different than somebody who, let's say, has been working in a library or in, indoors, not getting the sun exposure. So I think their treatment goals and what their skin is going to look like is going to be a good, a tell for you on that.
Right. And that's where probably, I would say Spa Connect can come in and evaluate, provide the good faith evaluations and determine, from a contraindication perspective, is this particular therapy a good fit?
Right. Exactly. And we'll talk a bit about that more on the next slide too, of having, a clinician who is well-versed in these treatments to look for the right patient selection to make sure, if you have a patient that has just really gravity has taken over, right? And there's nothing no amount of Botox or no amount of anything we put on it is going to fight that gravity. It's time for a surgical intervention. So, having somebody who's well-versed in these topics is very important, and looking for the right patient. But these are incredible. Troy, is there anything else that you want to add on here with as far as what you guys have seen at your office or questions that you're getting about new things coming?
Well, I mean, obviously, natural fillers like biofillers. If you're capturing the PRP, you can leverage a portion of that in the PPP to make a natural filler. Right. Again, it provides an alternative to other similar therapies that are out there, as you had mentioned, getting that natural result to what the patient is looking for. I think as we kind of continue to I say we, but society as a whole, looking for more natural ways of caring for themselves. Right. Not just the aesthetic, but in diet and other things, but the medicine side, right? So I think we're not even at the cusp of what can be achieved leveraging one's own PRP.
Yeah, exactly. Oh, Megan's got another. Thanks, Megan. I love these questions. She says she's heard after the age of 45, a person's own cells are too degraded to have great results with PRP. Oh, I'm glad Troy's here on that. Troy can plug in some stuff that you've heard and seen. What are your thoughts about that age point?
Yeah, well, again, I think when you said the age can vary, right? So it's going to depend a lot on the individual's health at that point, right? If they have some other contraindications that could either lower that age of 45 or maybe even increase it a little bit. But that's where I think some of the combination therapies can enhance or supercharge the overall protocol, right? So like Megan, I think, was the one that had mentioned the exosomes.
Yes.
Combining that with PRP, if there is a something within the platelets that maybe is not up to par, or the proteins are, as she kind of mentions here, the age is affecting to a little bit, you can supercharge that, because at the end of the day, you still have platelets that are functioning, right? I would say for a normal individual, right, a healthy 45-year-old, not considering those contraindications, because if you cut yourself, a 45-year-old is going to typically, it's going to clot, you stop bleeding, right? And that's where those platelets are playing a role. So I would definitely explore the combination theory of PRP and something else like exosomes.
Perfect. All right, we have another one about FDA clearance. I think, Troy, you're going to talk about that in a little bit too. Like, does it have FDA clearance? If yes, please provide the link.
I assume it is referring to our PRP devices. And yes, our 20 cc kits do have FDA clearance, and I guess I can provide that in the chat. It's on our website. So if you go to our website and just in the search bar, which should be in the top right, you click on search FDA, you'll pull up an announcement which has a link to the letter for our FDA clearance for our 20 cc device.
Awesome. Perfect. That's nice and convenient, right? Just put it in here, search, boom, there it is.
That's right. Website's got a lot of good information.
Yes, it does. It's colorful too. I like that. Nice. That's the color. All right, we're going to talk about just some safe practices, which safety isn't always sexy. I think it is. I think it's very fun. But we'll talk a little bit about safe practices. Like I said before, so I work for Spa Connect, which is an aesthetic telehealth company. And what we do is we provide good faith exams health screenings, medical clearance, things like that, for clients who have their patients who are ready to do a treatment like PRP, or they're doing microneedling with PRP, or they're doing a combo treatment. But what they need to have beforehand is sitting down with a licensed professional to go over their medical history to make sure there's no contraindications to treatment. And that's where we really shine. Our team we have a team of 25 plus nurse practitioners. Hi guys, I told them to watch if they're not working. Hi. They are the best in the business. They are all aesthetically trained. They can weave in and out of a visit just with such class, professionalism, and they leave the patient really excited for the treatment. They really just make sure that all the T's have been crossed, I's have been dotted. And that's just, I could probably talk for 30 minutes about the team. Megan loves Spa Connect. We love you too, Megan. So I will leave it there for right now. But some safety practices to consider: training, right? Especially when we're talking about PRP treatments, right? You need to be trained on how to use this device. It's not just one of those things like, let me just go ahead and draw some blood. Let's put it in a vial. I'm going to shake it up and then just rub it on. It doesn't work like that, right? There's a little bit more steps involved. Dr. PRP makes it very simple and foolproof. Even myself, I'm like, I love the vials. It tells me where to pull, when to stop, how to twist. It's very simple, user-friendly, but there's training involved. So you need to make sure that your clinicians who are providing these treatments have the proper training. As a patient, you need to make sure you're asking those questions too, of like, hey, have you been trained on this? When, where did you get your training? How did you, and asking about that to really understand that they know what they're doing, right? Because we live in a wild world where it's very easy to get access to things. So you want to make sure the person that you're trusting to do this procedure on is trained, and they're trained regularly, and they're up to date, up to speed on new practice guidelines in the industry. They have a relationship with Dr. PRP that they can call if they have any questions. So training is really huge. We touched on this a little bit earlier: patient selection and treatment considerations. Spa Connect, this is your answer. If you are like, oh, I'm not really doing that right now, you need to. Pre-procedure health screenings are mandated in every state in some way, shape, or form. They're not optional. They need to be done before the patient receives their treatment. And one of the crucial things about that is making sure the patient selection is correct. And we're asking all those like allergies, right? We're asking, do you have any allergies to anything? Which is another great thing about PRP. You can't be allergic to yourself, which is, I mean, I suppose you can. My allergies year round are terrible, but I can't be allergic to my own PRP. I had a patient one time, she's like, well, what if this blood is in a different part of my body and then all of a sudden it's on my face? I'm like, well, it's kind of like you had a sleepover at someone's house and you're on the couch. It's okay. It may not be your bed, but you just go right back to where you need to be.
That's right. Sleepwalk.
Yeah, it was like a really great question. I'm like, it's just yourself. So you just kind of, it just goes back doing what it should be doing, just in a different spot. So looking for things like allergies, sun exposure. Is the patient immunocompromised? Something really to consider with PRP. I'm drawing blood. Are you anemic? Do you have, do you have any bleeding or clotting disorders? Things like that. The considerations that you need to be asking prior to starting this treatment are very, very important as a clinician protecting your license and as a patient protecting your health. And Spa Connect is just really, really shines here. Like I said, all of our providers are aesthetically trained, know how to do this, understand the importance of these things, and they are in and out of these visits so they can help you get your schedule filled and maintain a nice efficiency. Creating individualized care plans for best outcomes. That's really important. Troy just talked about that quite a bit as well of, if the patient is 45 or if the patient is 20, things depend, right? Your protocol may be different based off those age groups, based off of risk factors, based off of all sorts of different things. If you have somebody who is currently going through chemotherapy, right, and they're immunocompromised, this may not be the best option for them right now. It doesn't mean that they can't do it, but creating a care plan of like, all right, let's see, let's talk about this. Let's talk with your oncologist, things like that. Really, really taking the time to do all those things are best practices and safe practices for everybody.
And again, just to highlight that, Sarah, I mean, that's what patients are really looking for, right? They want the physician to really evaluate their situation and give them the best options. Right, and discuss the options with them so that they can get the best result at the end of the day.
Exactly. And you know what? It makes them feel seen too. I know I feel seen when someone's, because normally my kids are screaming, whatever, and then I'm in a spot, I'm like, oh, you're listening to me. This feels really good. You see me. This is great. But it's exactly, that's exactly right. And then one other bullet point on here is post-procedure education. So actually, Troy, I'm going to pick your brain on that too. With PRP, what would be some things that the patient would want to think about when they go home?
Well, obviously they want to think about, how do I continue to recover, right? Are there some products that I can apply to the face to not only continue the process of recovery, but also retain the results that one captures, right? So there's that aspect. If for aesthetics, how long is it going to have maybe the face be red? Is it hours, days, depending on the type of application one is being seen for, and so patients want to know, okay, I've had my PRP therapy. Now that's not the end of it. What do I need to be doing at home to ensure that I get, again, the best outcome possible with this particular application?
Right. And this always makes me think of PRP hair too. It's like, so I have all this liquid gold on my head, whether I've injected it, whether I've rubbed it topically, whether I've microneedled it. I don't want that patient going home and showering right away. Like, don't just leave it be. Let it do its magic. I had a patient one time. He's like, okay, I've got to go coach a game. I'm like, well, do you run around? Are you going to get really sweaty? He's like, yeah. Like, well, like maybe could we, and just kind of explaining that education, because you want them to get the best results. And that goes for any treatment, whether that's an injectable treatment, an energy device, a wellness device, regenerative. Right. You want them to get the best result for them, right? Of course you want them to come back, but as a patient of this industry myself, like, I want to make sure that those lines are getting taken care of and I'm getting the best result possible. So it's really important to have that post-procedure education.
Right. And no, absolutely. I mean, an analogy that kind of came to mind is, fertilizing your lawn. You don't just throw it on there at any point in time. You kind of need to maybe look at the weather. If it's going to be windy, you don't want to be blown off, or you have a huge storm come. like I had, and then you blow everything off as well. But you do need some light rain, right, to make sure it applies well down into the soil. I love your hair example, right? You don't want to just go home and wash it off, right? You want it to leave it there so that it can, if you microneedle it, get into those micro channels that was created.
Right.
Great example.
Exactly. So just kind of moving along here is, the next thing that we were going to talk about is just, are you compliant, right? Are you doing everything that you need to do at your med spa? Are you aware of what your legislative requirements are? Are you doing good faith evaluations? Are you using FDA-approved equipment? If a patient asked you, where have you been trained? How do I know this? Are you ready to answer those questions? So that's one thing that, Spa Connect, again, really shines at, is we are a compliant solution to help to make sure that if you don't have a prescriber on site, we can help you with that, with our team that's able to complete these good faith evaluations for you, give you a treatment plan that allows you to start using your SOP by your medical director. Do you have SOPs in place? Are your protocols updated? What equipment are you currently? Oh my gosh, Tiffany, our moderator, I'm reading my own, what I just said. I thought that was a comment. All right, moving forward. So speaking of compliance, are you getting those good faith evaluations done? And then, is your equipment safe? How can you make sure? How do you know that the equipment that you're using is safe? So I'll just have Troy talk just a bit about this.
Yeah, I'll just talk briefly. I know we're well into our time here. So, FDA clearance, and somebody had a great question around our PRP device. So yes, the 20 cc PRP device that you can see there is FDA cleared, and we have that letter on there. So, when you want to ask those types of questions, when you're considering, if you don't have PRP today, or maybe you do, is it FDA cleared? And then we've talked a little bit about the safety aspects of PRP. But just some things. Obviously, in general, you want to make sure you maintain a sterile environment, right, so that you're not having any type of contamination with the therapy. And some special features on our Dr. PRP kit is the silicone. We have a silicone seal at the bottom so that it maintains, and the top so that it maintains that closed system, right? And actually, a special trick there is at the top, it actually has two silicone seals, so that when it comes time to actually extracting out the PRP, your final product, that liquid gold, which I love, you said that earlier, you can get your needle far enough into that top chamber of the device to extract that while maintaining the closed system, right? And make sure there's no contamination taking place when you're going through that process. And our devices are gamma rayed sterilized. So, I mean, these are able to be used in a surgical situation, right? And they're individually packaged, so that if you only need one, you have that, and it can be ready to go in a sterile type of application, or if you need multiple, right? So you have the ability there to ensure that you have a very safe and clean device in your particular use. Love
that. My personal AAA type self, I love the second rubber seal on the top, so I don't have to open anything to extract with because that just, remember the first time I opened a Dr. PRP kit, I was like, oh, they've thought of everything. This is so great, because you don't have to open anything, and you just don't, it's just really, really nice. So I love that. All right. Well, I think we're going to just pop into Q&A, and then we'll wrap up. We've just had so much time talking about PRP. Troy and I could sit here all day. So if you have any questions, comment below. Let us know. You've already been doing that for us, which I appreciate very much.
Yes, absolutely.
Yeah. Any questions, we are happy to answer them. If you're like myself and you think of things after the fact, you can always reach out to us on socials or on our website. Question: what are the benefits of microneedling with PRP versus injecting PRP?
Yeah, I can take that. I think so. Great question. As we've got a great audience here with great questions. So it kind of depends on what you're looking for, right? The microneedling piece of it is can provide that overall skin rejuvenative therapy, to the patient, and you're going to be applying that all over, typically all over the face and neck region, as we maybe briefly talked about a moment ago. So it's great from an overall standpoint for collagen induction. Whereas injecting PRP, again, it depends on what your needs are for the patient. It's going to be targeted, right, in a particular area on the face or what have you, to apply that PRP in those localized areas. And you have more, obviously, depth may be a concern or a consideration, maybe a better word, because the microneedling obviously is going to be less deep, or you typically less deep than injecting, right? So if you're looking to, a lot of questions again we get is about injecting PRP for under the eyes. That would be more of a need for injection versus microneedling, where you're really creating all these small abrasions to allow the PRP to seep into the underskin, right? So that's where you're going to really get the overall benefits if you're looking for that type of therapy.
Amazing. That's good information. It's good points too, right? Really considering depth, right? And patient outcome. So what you're trying to achieve.
Right. What are you looking for?
Ooh, big question on the bottom. Are GFEs mandated in all states? Yes. Very simple answer. Yes.
That's the easiest question.
That's a great one. I love it. Depending on the state that you reside in, it is required in some way, shape, or form. However you dice it, there is some sort of requirement by every state that you need to be doing good faith evaluations, medical screenings, health screenings, whichever term you would like to use. But that needs to be done for patient safety, right? Obviously. But one other one that's not so obvious is for license safety. Everybody works their buns off to earn the degrees and the licenses and the training and the things that you go through, your businesses, right? You need to protect those. So doing everything that you can to protect what you've worked so hard to build is really, really important, and making sure that patient is going to be safe and happy with the outcome and trust you and come back. So yes, GFEs are mandated in all states in some way, shape, or form. And then it looks like I got one other one. I love these. Thanks, everybody, for the questions. How often should I train my staff on safety protocols? Troy, do you want? I feel like we could both answer that in our realms. Do you want to take a stab at it first?
Yeah, absolutely. Obviously, if you have any new staff coming on, you want to train them right away as you're onboarding them, so that they can have the full gamut under their belt when they're working with patients, and then I would say at least once a year, or as things change, right? Something may change within a 6-month time frame from when they originally trained, and so you want to make sure that they are up to date on the change in a particular protocol.
Perfect. I agree. And say ditto, right? It's you just want to make sure that you're up to date on practice guidelines, legislative guidelines, that everybody is aware and following our two companies on socials, on websites. Being really aware of what's going on in the industry is really important to make sure you're staying safe. And then, of course, completing the training frequently. All right. Well, thank you so much for all of your questions.
Great
we appreciate it so much. What's next? Visit spaconnect.com, drprpusa.com to learn more, start working with us, follow us on the socials. Let us know what other content you would like to see covered, because this is fun for Troy and I. We're just sitting and this is great. So let us know if there's other topics. Share this webinar, replay the link. It's available on Spa Connect's YouTube and Facebook pages. And also for the Instagram audience, you can find the replay of the live on our YouTube, on Spa Connect's YouTube channel. That is it for us. Thank you so much, everybody. We welcome you to learn more with us. I appreciate it. Did you have a great takeaway today? What was your aha moment from our chat? Please share those with us. Share them in the comments, socials, all the things. We'd love to hear from you.
Absolutely. Yeah, great audience, great questions. Appreciate everyone joining. It was a great discussion.
Yes.
And thank you again, Sarah, for joining me and allowing me to join you to talk through these different topics.
Thank you for being here, Troy. I appreciate it.
Absolutely.
All right, until the next time.
Same back channel.
Yes. Take care, everyone. Thank you.
Y'all have a great day.